HMPV outbreak data and critical transmission patterns. Welcome to the official Global RPH YouTube channel. If you haven't already, hit that subscribe button so you never miss out on our latest videos. Respiratory illnesses have drawn worldwide concern as Chinese hospitals report record patient numbers. The China pneumonia virus outbreak has hit children and elderly people hard. Healthcare officials worry about how fast it spreads and its effects on the population. Scientists have identified human metapneumovirus, HMPV, as the leading cause behind this mysterious respiratory outbreak in China. Their analysis shows key transmission patterns and epidemiological data that explain how the outbreak unfolds. Detailed research and data collection help us learn about the virus's behavior, its effects on different age groups, and how healthcare systems handle this challenge. The complete analysis shows the outbreak spread across regions and clinical data trends. It also reviews how well current containment measures work. These findings give valuable lessons about managing this respiratory health crisis and stopping future outbreaks. Scientists first found human metapneumovirus, HMPV, in 2001 in the Netherlands. This virus has been around in human populations for at least 70 years. Research shows this respiratory pathogen has grown into a major global health issue. About 90 to 100% of children get infected by the time they reach 5 to 10 years of age. Since its identification, the virus has spread worldwide. Two major genotypes, A and B, show unique transmission patterns. These genotypes can spread together during outbreaks, creating a complex pattern of disease spread. China is experiencing a major surge in HMPV cases. The virus ranks among the top 4 most common viral infections in hospital visitors. The virus follows clear seasonal patterns in different regions. Temperate climates see HMPV peaks during late winter and early spring. Research has shown that Northern Hemisphere peaks happen in March. Tropical regions see peaks during spring and early summer. Some regions show patterns every 2 years. HMPV transmission rates vary widely. Hospital admission rates reach 22 cases per 10,000 person-years among adults 65 and older. Environmental conditions play a vital role. Higher relative humidity and more rainy days lead to increased transmission rates. Disease severity varies considerably among age groups. Children with underlying conditions show a higher risk for severe illness. Research shows that 85.4% of cases have hypoxia, while 70.8% show visible chest radiograph infiltrates. HMPV patterns differ from other respiratory viruses. Annual hospitalization rates for HMPV, 1 per 1,000 children, match those of influenza and parainfluenza viruses. Notwithstanding that, this rate remains nowhere near RSV infections, which account for 3 per 1,000 hospitalizations. The current outbreak shows more severe manifestations than in previous years. Hospital stays now last an average of 6 days, and 14% of patients need intensive care. These numbers indicate a radical alteration from historical patterns, which suggests changes in virus behavior or host response. Chinese healthcare facilities have implemented detailed measures to manage the rising HMPV outbreak. Patient numbers have put the greatest pressure on hospital resources, and social media posts show packed waiting rooms. HMPV patients stay in hospitals for a median of 2.8 days. The data shows that 18% of hospitalized patients need intensive care treatment, and 6% require mechanical ventilation. HMPV hospitalizations cost $7.9 million during our study period. No FDA-approved antiviral therapy exists for HMPV infection yet. Medical teams have identified several treatment approaches. Ribavirin combined with IVIG shows promise for severe cases. Supportive care with respiratory support as needed. Oxygen therapy for severe cases. Mechanical ventilation in critical situations. Our healthcare system's reliable emergency protocols are now in place. RSV-like infection control protocols have proven to work. These protocols include droplet isolation until clinical recovery, better monitoring systems for pneumonia cases, pilot programs to track infections of unknown origin. HMPV could lead to about 27,000 hospitalizations yearly in children under 18 years old, and the estimated medical costs could reach $277 million. Northern provinces show a clear pattern of infection among children under 14 years. HMPV also follows strong seasonal patterns. The peak activity happens from March to May in China. Several environmental conditions affect how HMPV spreads. The evidence shows that the virus spreads best in spring months, with infection rates of 12.13%. Temperature and relative humidity play vital roles in how the virus spreads. Detailed contact tracing reveals clear clustering patterns. Family clusters make up 40% of total cases. Siblings often pass the infection to each other. Schools make transmission easier, as shown by simultaneous outbreaks in nearby schools and kindergartens. HMPV can spread directly between cells, even when neutralizing antibodies are present. This explains why it spreads so well in closed spaces. Students who walk to school and rooms with limited window ventilation, less than 2 hours, face higher risks of infection. A detailed analysis of China's HMPV outbreak shows key patterns that healthcare professionals worldwide need to know about. Our research and data collection reveals that this respiratory virus creates serious risks. Children under 2 years old and elderly populations face the greatest threat. Regional data varies across China, with Chongqing showing the highest numbers at 15.88%. Clinical findings prove that different age groups experience varying levels of severity. About 85.4% of patients show hypoxia symptoms. Healthcare systems have implemented strong measures, but treatment options remain limited. We still don't have FDA-approved antiviral therapy, which makes better preventive strategies and ongoing research crucial. The virus follows clear seasonal priorities and spreads most during spring months, when infection rates hit 12.13%. This knowledge, combined with our grasp of environmental factors, provides an explanation to help prevent future outbreaks. These findings represent major progress in our grasp of HMPV behavior and spread. Our ongoing monitoring will help create targeted interventions and better ways to manage respiratory diseases globally. Thank you for watching our Global RPH production. If you found it enjoyable and informative, please consider liking the video and subscribing to our brand new YouTube channel. Our content spans a wide range of topics designed to appeal to a diverse audience, ensuring there's always something fresh and engaging for everyone. Your support helps us grow and continue to provide interesting and valuable content. Stay tuned for more exciting videos.